If you are a woman, you can't afford to ignore this. Your life depends on it. It is a cancer warning about a disease that only affects women. It's a silent killer. It is ovarian cancer. Beginning today, Penn Medicine, the Sandy Roman Ovarian Cancer Foundation, and Talk Philly are all joining forces to take a stand against this disease that takes more than half of the women it strikes.
13 years ago, Terry Loring didn't know she'd become a statistic.
Statistically, you shouldn't be here.
Exactly. I shouldn't be here. But I'm one of the lucky ones. And I listen to my body.
Terry had ovarian cancer, one of the most challenging diseases that affect women, and a disease that Dr. George Kukos at the University of Pennsylvania has committed his professional life to.
Every year there are about 25,000 women who die from ovarian cancer. 45,000 women are diagnosed with ovarian cancer every year. So you understand that the number of women who survive ovarian cancer is not that high.
Primarily because when diagnosed, ovarian tumors are advanced cancers. Dr. Kukos, a global leader in ovarian cancer treatment and research, calls it a silent killer. The symptoms are vague.
The classical symptoms for ovarian cancer are a constellation of pelvic symptoms, so pelvic pressure, urinary frequency, back pain sometimes, a sense of fullness.
Terry experienced all of that. An astute physician called for a critical test.
He said, "I'm sending you for a pelvic ultrasound." And then from there, the ball just ran very quickly. And 2 days later, I came back with a diagnosis of ovarian cancer.
An advanced stage 3C.
This is a large metastasis of ovarian cancer.
In his research, Dr. Kukos looks at these tumors as holding the secret to a cure.
We try to come up with therapies that will boost the ability of the body to fight the tumor.
One promising study uses immunotherapy.
We use the patient's own tumor to re-educate the body that that component of the body is foreign and needs to be rejected. It is a completely personalized vaccine. It's based on patient's own blood, and patient's own tumor cannot be used for any other patient. The idea is by developing more potent immunotherapy and in combination with the chemotherapy, we can push further the envelope and improve the survival of at least a proportion of these patients.